So you're at your surgeon's office and they say, okay, you're cleared to go back to the gym. You're cleared for activity and for exercise. And you think to yourself, the gym? I can't imagine going to the gym. I can barely wash my hair without discomfort. I still feel pain. I still feel tightness through my chest. My name is Amy Shamsis. I'm a physical therapist and founder of Flow Physical Therapy. I've been treating women with breast cancer or those who have had a prophylactic mastectomy for over 20 years. I can't tell you how many times I've heard this where women come in and say, my surgeon said I can do whatever I want and I'm afraid to move. So I hope this video helps. Please note the disclaimer that this is for educational purposes and doesn't, you need medical clearance from your doctor to start moving. And if anything doesn't feel right, please contact your surgeon or healthcare provider. So first and foremost, the goals are that you want full and complete breathing, right, to relax and calm the nervous system, to relax the tissues. The body is sort of in this fight or flight mode where it's in overdrive, trying to protect and sort of understand what's happening. So breathing is essential. Then, obviously, that breath work can help with some of the discomfort and pain, but our goal is to decrease pain. And then, for more than anything, is increasing range of motion first, right? You can't really get back to the gym or back to whatever the things are that you like to do if you don't have full range of motion. When my patients come in on my initial consultation, I'll ask them, you know, what their goals are, what they want to get back to. If they were tennis players, if they were rock climbers, if they loved yoga, whatever the activity is, our goal is to get you back there. So what I first want to do is we'll do some breathing exercises, and then I'll show you some preliminary stretches and movements you can do safely in standing, because we can't always lie down on our mats. And then we'll get down on the mat. So hopefully you have a mat. You have some throw pillows around to support the arm if you don't have that full range of motion. I think that's all you need. So you want to think about the breath as being 360 degrees of movement of the rib cage. So our lungs sit inside the ribs, right? It's like encased in the ribs. And the reason why it's important is not only about calming the nervous system and dampening the fight or flight response, but because the muscles that are impacted by this reconstruction attached to the ribs, so many of my patients will come and say, my rib hurts when I breathe, or I can't because I have pain on that side, my ribs hurt. So again, expanding through the ribs, right? Getting a little more play in between each rib, and then expanding fully will also help indirectly with range of motion of your shoulder. So we'll do some breath work now. You'll close your eyes. You're gonna think about really letting the belly go. So please try to relax the belly, don't hold it in. And you'll breathe in and out slowly through the nose. You want to feel your ribs expand front, side, and back. If you're able to, you can even bring your hands, the thumbs toward the back, the fingers toward the front, onto your rib cage. Drop the shoulders down, soften the elbows a little bit, and see if you can feel that expansion of your ribs. Breathing in. And breathing out. And you're comparing right side to left and left side to right. So maybe when you're doing this, you say to yourself, oh, it kind of hurts, or it doesn't feel as mobile on the left side. So then maybe as we're stretching more, we can have an impact on that as well, and decrease that discomfort. You can bring your hands down if you have an idea of what's going on, and just keep breathing slowly. The goal is a 5-second inhale with a 6-second or longer exhale. Good. Exhaling, letting everything go. So we'll stay with that breath throughout the next series of movements. So you can come to stand. Again, this is preliminary, that if laying down is too difficult to get the range of motion there, we can do things in standing. So you can do some wall climb. So your hands are on the wall. You're gonna walk your hands up the wall as you walk into the wall. Breathe here. Relax the shoulders. Relax through the chest and the armpits. And then walk your hands back down. And then down onto your side. So you can do that a few times. And then you can do some breath work, breathing in, bringing the arms towards the head, out to the sides, and then breathing out. So you only go as far as you can, right? We're just starting to get some movement, right? Not pushing, not forcing, but getting movement with breath, that connection. Going where you can, so that if 0 is no stretch and 10 is excruciating stretch, you want to feel at least a 4, maybe a 5 or a 6. Okay, and then the next thing you're going to do is hands behind your head, and then hands behind the back. Hands behind the head, right? And maybe you're here, your elbows are forward, and maybe it's too much to bring them out. So wherever you can move, you move. And then hands behind the head, and hands behind the back. This can be done every couple of hours throughout your day, because the most important thing is to remind the tissue to be elongated, right? The tissue kind of wants to go back to where it was. It's saying, no, I'm going to try to protect this person. But you want the tissue to remember to be long so that you can regain your full range of motion. So now we'll go back to the floor. You have your blankets or your throw pillows around to support you. You're going to come down onto your side and then onto your back. If you need a pillow underneath your head, if you're not used to lying that flat, use a pillow. Your knees are bent, your feet are hips width apart, and you're going to just bring the arms out just below shoulder height, just to see how that feels. And then back down. You want to check your own range of motion even before you start. So get a little feeling. What does it feel like? When do I start to feel the pull as I bring my arms out? Is it at shoulder height? Is it below? Or can I move above my shoulders? Notice that and where you are. Bring your arms back down. And then you'll bring your arms up towards the ceiling and then over your head. Again, just preliminary, seeing where you can go and how much motion you have before you have discomfort or pain. And then bring them back down. Right? So you're noting what your motion is to start. Then have your arms shoulder height or maybe a little lower. And bring the hands back towards the floor. So looking at rotation. So once you have that, those little numbers in your head, a little idea of where you're moving, you're gonna bring your arms out shoulder height. If it feels okay to be here, start breathing nice and fully in and out through the nose, right? That inhale will help to elongate the tissue, and the exhale helps to soften and relax. So use your breath to create more length. Walk the feet apart as wide as the mat, and start to move, dropping knees to the left. You want to stay here for 5 breaths. Letting go, softening through the face, the throat, the jaw. Good, and then bring the knees back up center and drop them over to the right. And remember, you're comparing left side to right and right to left because we never feel the same on both sides. I don't think I've had a patient yet that has the same experience on both sides. One side is always tighter. Good. One more time to the left. And then center. And one more time to the right. And center. And then you'll walk your feet closer together. You'll slide your arms down slowly. Your arms are down by your side, thumbs are pointing up, and on your inhale, you're gonna bring your arms up towards the ceiling. And as you exhale, reach the arms overhead to where you can. Sometimes this is difficult, right? Because the weight of our arms are pulling on the tissues in the front of the chest. Just go where you can. And then inhale back to center. And exhale the arms down. Inhale. Exhale overhead. Inhale. And exhale back down. Last time. Noticing if you're going a little further each time, really letting go. And inhale. And exhale down. Then you'll roll onto your side. And if it's uncomfortable to be on your side, you don't need to do this one yet, right? We're trying to get you more comfortable so that you can lay on your side. You can put that pillow or blanket underneath your head, and your knees are bent up, your hips and shoulder are in line. And we're gonna do little T-spine openers, they're called, or opening a buck. And on your inhale, you're gonna rotate open. Think of the ribs rotating, the spine rotating, you're turning your head to follow the arm. Your shoulder lands, your arm lands. This is a big stretch. And then exhale as you close. So if that's well tolerated, great. Just keep moving with that. If it's too much, you can either place a pillow on the opposite side of you so your arm lands on that pillow, or you can bring your arm a little lower down as it lands, so maybe lower than shoulder height. So drawing the arm down first and then getting that rotation. Turning the head to follow. And we'll do that one more time. Inhaling as you open, wherever you're comfortable. And exhaling as you close. Okay, and then you're gonna push to get up and you're gonna come the other way. So your hips and shoulders are in line. You bring yourself down onto the mat. Arms are out in front of you, knees are bent up, and you can place your pillow under your head if you need it. And on your inhale, you're gonna rotate open, turn the spine, ribs rotate, head rotates, arm lands. Again, if it doesn't land, just take that pillow and put it to the opposite side of you so that you can feel the stretch but not sort of be in pain while you're doing this. And we'll do 2 more. Just moving slowly, noticing what you feel, noticing the difference between the 2 sides. Good. Okay, and then the next and last 2 things we'll do is coming onto your hands and knees. Now that might seem a little daunting at first, but the more you start to work all the tissues around the surgery area, the better the body starts to feel and the more you can integrate what's happening in the body. So you're going to turn the hands out slightly on the mat. Your knees are right underneath your hips, and we'll do a little cat-cow. We can just do a little shifting of the weight forward and back a couple of times to start to feel weight into the hands so that the shoulder muscles start to work a little bit, right, to stabilize you. And then find stillness where you feel some weight into the fingertips. You're going to look just beyond your mat. And as you exhale, you're going to start at your tailbone. You're going to round the spine, round the lower, round the mid-back, round the upper back. Really let the head and neck go. And as you inhale, you're going to bring the tailbone up, extend through the lower back, mid-back, upper back, and lift the head. We'll do that 2 more times, exhaling as you round into your cat pose, breathing. And inhale as you lengthen through the front body, shoulders away from the ears, and lift the head last. And then the next thing we're going to do is child's pose, maybe supported. So maybe you take your block or your towel or your pillow. You're going to bring the knees wide. If you have any trouble with your knees or hips, you can just modify this, not coming all the way back to your heels. You're going to think of looking forward, walking the hands forward, and then place the forehead on the blocks, on your pillow, on whatever you have to support you. Find your breath again. Breathing fully in and out through your nose, feeling the expansion of the ribs, especially in the back of the body here. And then walk the hands back up. Come to sit back onto your pillow or a block or a chair, wherever you feel most comfortable. So remember, when the doctor says Okay, you can go back to the gym. Start with these gentle exercises and movements first, because first and foremost is to decrease pain and discomfort, increase range of motion, and then slowly get back to all the things that you love doing. As a side note, you want to remember that weights and weight training shouldn't be started until at least 6 weeks. And then at that point, you want to start off light and just progress incrementally over a few weeks at a time, increasing the weight when you're ready. Maybe 2 or 3 weeks, a pound of weight each time. I hope this video helps and gets you back to everything that you loved doing.